Thank you to the Ambassador and to all of you for joining us here in the room and to everyone who is joining us online around the world. We really appreciate you taking the time to discuss an incredibly important issue that does not get enough attention. We just heard about the incredible role of women in addressing AMR and also the role of governments and governance. And I think it's really important also to shed a light on the human experience and the human face of how AMR is affecting people around the world. And so I'm really excited to have the opportunity to talk to you and learn from your experience. And, you know, AMR risk compromising medical gains that have occurred, you know, across decades. And also it's making what are relatively simple medical treatments more difficult to treat. And AMR is increasingly putting them at risk. And so from your work and with the Infectious Disease Society of America, how are you seeing this manifest? You're working with physicians, doctors, scientists, and are very much on the front lines of this. And so if you could capture that for us and for our audience so that we can all understand a little bit more how this is showing up every day.
Absolutely. So I think first it's so important to understand that antibiotics are really fun procedures that we have all come to depend upon: cancer chemotherapy, surgeries, organ transplants, C-sections, hip replacements, knee replacements. I could go on and on. They all carry a risk of infection, and physicians have been able to be very bold in driving all of these types of progress forward because we've had antibiotics to fall back on to make these healthcare procedures safe. And as antibiotics are losing their effectiveness, these healthcare procedures are becoming more and more dangerous. And I think where that shows up every day is when clinicians have to tell their patients, I'm sorry, we don't have something that will treat this infection. Or when clinicians have to deny a patient a life-saving organ transplant because they know it won't be safe to do. And I think that is something that our members and I think healthcare workers across the world find unacceptable, and that's why we're calling for more action on AMR.
What role do physicians have to play as part of this and those who are prescribing antibiotics? I think there's a very important question around stewardship and what role do they have to play from your perspective and also those who you're working with.
Absolutely. So we know that overuse of antibiotics is driving this problem. And so I think there's been a lot of attention to using antibiotics wisely. You know, stewardship is really about making sure patients get the right drug for the right bug, the right dose, the right duration, and making sure that people who don't need an antibiotic don't get one. And I think that it's important for clinicians not only to prescribe accurately, but to help inform their patients and their communities about why we're trying to use antibiotics more wisely. And it's not just about resistance. Antibiotic use can have adverse effects on individuals as well, which is something that I think is not as well understood. I think the other really important role for healthcare professionals is not only in their day-to-day practice, but as advocates. You know, and that means working at a global level to help inform, you know, decisions and activities, as well as within their own countries, really trying to drive progress with their own Congress or Parliament or health ministers to help them understand what are the challenges on the front lines.
What are some of the key interventions related to access? You know, you're working in a number of different communities, large cities, rural areas as well. And so when we think about access and we think about antibiotics and this overlay of AMR and the impacts, what are some of the key areas that need to be focused on?
Absolutely. I think, you know, first we need to make sure that we have a strong healthcare workforce, and particularly a workforce trained in infectious disease, so that patients who have infections or who are at risk infections because of their underlying health conditions can be able to see someone who can prescribe them what they need and make sure that we can ideally prevent infections in the first place and be able to diagnose and treat them rapidly and appropriately. Then, of course, we also need access to the antibiotics themselves. And I think that is really a combination of both access and innovation. You can't access a drug that doesn't exist because nobody wants to make it. So we've got to drive innovation. And we need to do so in a way that promotes you know, appropriate access and that promotes good stewardship. And I think that a number of countries talking about something called subscription models, maybe we could talk about a little more, is a really important, innovative way to drive sustainable innovation that also aligns with stewardship and access.
Great. Stick around, everybody, because we are going to dive into subscription models and also trade-offs with different incentives and models. You know, I'm curious as well, when we're talking about this issue and focusing on AMR amid a number of other challenges, global health priorities, limited funding, et cetera, why should we focus on this now? And when we were talking before, you know, this question about the cost of inaction came up. And so when we think about the cost of interventions and the investment that's needed, which we'll dive into, how would you characterize the cost of inaction?
So I think there are costs in terms of human lives, and there's cost in terms of economics. On the economic side, for example, in the US, just 6 of the worst pathogens cost our healthcare system in excess of $4 billion every year, because people have to stay in the hospital a much longer time when we can't simply give them a drug that works and send them home. The cost in terms of human lives and in terms of turning back our medical progress. So a couple of examples in the US right now, sepsis, which is the body's overwhelming response to an infection, is the 2nd leading cause of maternal mortality. Young moms are dying because we aren't doing enough on this issue. Infections are estimated to be about 50% of cancer deaths. Again, all of that, you know, innovation and progress that we've made in treating cancer, helping people live longer, we're losing it because we're not investing enough in AMR.
And I feel like this is a real opportunity. You know, we're convening here tonight ahead of the multi-stakeholder meetings tomorrow and in advance, as Andrew was mentioning earlier, of the high-level meetings here alongside the UN General Assembly in September. And so this is a real opportunity, not only for those in the room who are working across industry, government, practitioners, to really learn and think through how to work more effectively together. Here in New York tonight and in advance of the meetings tomorrow, where you sit, what needs to be prioritized?
So I think 3 things. Urgency. We've got to move quickly. Secondly, bold, actionable targets. As we are putting together that political declaration, it can't just be a lot of nice words about AMR is important. We need really clear, strong metrics so that we can hold ourselves accountable and move forward in the coming years. And I think thirdly, it can't just be about what happens here in New York. It has to be about what all of us do when we go home. And I know for our members who are primarily based in the US, we are always advocating to the US Congress, we need to pass the PASTOR Act. That's our subscription model bill. We need to invest in our public health infrastructure. And we need to do our part as one of the high-income countries to help finance change around the world.
Thank you for that. And it's interesting what's happening in this country, but also what we have to learn from others around the world in terms of models, policies, incentives that are being implemented, and really harnessing and focusing in on what's working and what can we all learn from each other. So thank you. But appreciate you being with us tonight and for the work that you're doing.
Thank you.
Please welcome James Anderson, the Global Health Executive Director of the International Federation of Pharmaceutical Manufacturers and Associations, to discuss the future antibiotic pipeline.
Great. Hi, James. Thank you.